everybody's saying things look great. Okay, wonderful. Thank you very much. Welcome, everyone, a little bit delayed, to our 29th Annual General Meeting. We're glad to have you here today. We're starting our AGM today with a webinar presentation called Return to Work Coordination, Key Competencies for Success with Dr. Glenn Pransky, who's joining us online from the United States. And we're glad to have him with us today. And my name is Tanya Hyde, and I'll be moderating the webinar today. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability. And we're very glad to have you all here with us today. As I mentioned, I'm Tanya. I'll be moderating. And our speaker today is Dr. Glenn Pransky. Dr. Pransky has directed the Center for Disability Research at the Liberty Mutual Research Institute for Safety since 1999. His research group conducts scientific investigations on disability prevention strategies, enhancing recovery in musculoskeletal disorders, work disability in older workers, and methods to achieve safe and sustained return to work. He's an associate professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School and a visiting lecturer at the Harvard School of Public Health and the University of Massachusetts Lowell. And we're very glad to have him with us today. Dr. Pransky, I am going to go ahead and hand it over to you if you would like to start your presentation.
Okay, thank you. Glad everybody's able to join today. I'm looking forward to sharing with you some of our research work and hearing some of your ideas about it. Let's start with the second slide. Where I work is the Liberty Mutual Research Institute. It's a pretty unique place. It's fully funded by Liberty Mutual, but our focus is on peer-reviewed scientific research. So we have a large focus on research that directly contributes to preventing injuries at work, as well as preventing work disability. And the work disability area is where I've worked for the last 15 years. Next slide. So in this recent review, Renee Louise Franche, also in BC, looked at the scientific literature on what interventions at the workplace lead to better return to work outcomes. And she said there's 4 areas that come through across multiple studies. Workplace accommodations, which are of course very important, direct contact among the worker, the workplace, and the healthcare provider, and if necessary, worksite site visits. And the 4th item on her list was the presence of somebody coordinating return to work. Next slide. So how you could define this return to work coordinator is basically somebody could be one of many different specialties or employed by different folks whose goal is to facilitate early reintegration of the worker into the workplace after a period of sickness absence. And ideally, the characteristics of this process would include face-to-face communication, not only with workers, but also with supervisors, providers, and others. But a lot of times this work is done telephonically. Next slide. So why are return to work coordinators needed? And there's been a lot of research on the sorts of problems that occur in a complex situation like return to work, where there's difficulties in communication, lack of trust, misunderstanding, people don't know what's really necessary for job modifications, fears about re-injury and the like. And so, next slide, there's been a little bit of work on who are in the role of return to work coordinators. And we've seen a number of people in with various backgrounds, and sometimes these folks follow all. But when you look in the published scientific studies that actually report on what people do and how much of a difference does it make, there's very little detail published. Next slide. So the goal of our research was to try to identify the key competencies defined as knowledge, skills, and attitudes and practices of return to work coordinators, and to see how much these vary depending upon where somebody works or what their specialty is, and thus use this data to guide selection of people, training, and maybe reinforcing the most effective behaviors of people in this setting. So next slide. The premise of this research is that if you want to study something like this, you get the best information by interviewing those, talking with those who are the experts in the field, and that you can use one group of people to sort of develop a series of competencies, and then if you think you're right, you can independently validate that in a second group. And next slide. So why was this important? One is that there's a lot of variation in the lay literature in terms of what people says is and is not important, and that although a number of studies suggest that yes, return to work coordinators are important, they don't really specify what it is that these folks do. And so it's sort of a black box. And a third problem is that when we began this research about 10 years ago, there was an increasing sort of specialty-specific attempts to sort of own the field. Next slide. And I give an example of one organization that basically has created a certification for return to work coordinators, and this is based on a documented length of practice and completion of an examination. And we wondered, well, is there an empiric, a scientific basis for this? Could you really find out who's going to be most effective and what's most effective based on these materials? So next slide, here's the components of the project we did. We started out with a thorough literature review. We then talked to the principal investigators of studies that did try to improve return to work outcomes. We then did a series of focus groups with expert return to work coordinators, and finally an internet survey. And so next slide, the literature review focused on studies where someone had put together a successful workplace-based return to work intervention with the specific goal of improving return to work outcomes. And we included everything we could find, not only randomized trials, but pre-post evaluations, and really focusing more on those workers who are out of work for less than a year. So we're not looking at what's a vocational rehabilitation. You're going back to a different employer situation. We're really focused more on coordinating return to work for people to the same employer. And next slide, what we found was that in talking to these folks that, of course, return to work processes are complex. Most of you know this, that the easiest part sometimes is treating the medical condition. More complicated might be figuring out what work capacity is, addressing worker and employer concerns, adapting the worker to the job, adapting the job to the worker, and communicating among people and getting everyone to agree to a return to work plan. And so next slide, when we looked at the literature review, we found a number of different elements or processes that we were able to identify, some of these in one or two studies, some of these in many studies, that were characteristics of return to work coordination. And what was interesting is that these studies specified a lot about what people did, but had very little on the qualifications or skills or training for the person in the return to work coordinator role. So then we went and interviewed the principal investigators of each one of these studies. Next slide. And we did a content analysis of the answers to these semi-structured interviews. And next slide, we contacted 13 principal investigators. And surprisingly, what they all said is, yes, I tried this organization process, or I used these rehab folks, or I had this type of physical therapy, but the key person was the person in the role of the return to work coordinator. And they all said, this person was key to the success of my program. And the backgrounds were highly variable. Some had nurses, PTs, OTs, some had teachers, some used folks who were VR specialists. But what seemed to be something in common, that these were people persons. They were good negotiators. They were effective communicators across a wide variety of people. A little bit less emphasis on some specific knowledge in a specific area. So next slide. The next step was to conduct a series of focus groups. And we did 8 focus groups in the US, Canada, and Australia with over 75 participants. To get into the focus group, you had to be working most of the time as a return-to-work coordinator, minimum 3 years of experience, and on average people had far more. And we got a wide variety of folks, backgrounds, work arrangements, and we asked them to tell us, what do you think are the specific essential competencies for success? And we ended up with a total of 904 items. So a lot of items, but they weren't all different. So we condensed these to 255 individual items, and then on the next slide, we categorized them into these sort of 9 different skill areas: administrative skills, basic personality attributes, information collecting skills, communication skills, the ability to be a credible person, evaluation skills, some general knowledge, managing conflict, and then some specific skills around return-to-work coordination and problem solving. And so, for example, if you look at the basic attributes here, you can see these were the 6 top things that people said were really important in terms of the sorts of characteristics people had to have. They had to be approachable, available, having a positive attitude, non-cynical, patient, assertive when necessary, perseverant. Next slide. And then this is sort of this slide shows the communication skills that people thought were most important. Next slide. One of the most interesting things was we always ask folks, so how did you get to be tops in your field? And nobody said it was by taking a course or passing a test. They all said, 80% of what got me from good to great was being the right personality, but then I became an expert because I had mentorship and experience, and I learned from my experience. And that was pretty interesting because that conflicted with a little bit of what we had heard from the folks in the certification business. So we took, next slide, we took the results of these focus groups and we developed an internet-based questionnaire where we took the 90 highest rated competencies, added in 10 that were less commonly endorsed, and next slide, we asked people to rate their skills, knowledge, and attitudes, each one of these, and how important they thought this would be for their role as a return-to-work coordinator. And I show you some examples here of some of the questions that we asked. We also had a list of practices of what do you do in your job, and they answered yes, no to them to get a scope of the work. We did some cognitive testing to make sure the questionnaire was understandable, giving us the data we wanted. And we then sent this out on the internet. Next slide shows you an example of how we would ask the questions. And then on the next slide, you can see the demographics. We had almost 150 respondents, US, Canada, and Australia. About a third of them had a vocational counseling background, some certified, some not. Nurses, various other backgrounds. They worked for a wide range of different employers. And over 80% had more than 5 years experience, and more than half had 10 years or more experience. Next slide. And so here are the top items that were rated very important or essential by more than half of respondents. And you can see the average rating across all respondents for these things are more than 4.4 out of 5. So there's very strong consensus about these skills that everybody is saying, no matter where they work, these are essential. And you'll notice that in these expert return-to-work coordinators, the top skills they're identifying don't have anything to do with book knowledge or training. They have a lot to do with how people work. The flip side are the lowest rated items, and these ratings are not terribly low, but they're significantly lower on the next slide. And you'll see a little bit more knowledge items here. And then if you go to the next slide, this is the average rating of items in each of these sort of affinity groups, where we ask the experts themselves to talk about the different skills, that groups of skills that they thought held together. And you can see that professionalism, good communication skills, these individual personality traits, being able to be organized, resolve conflict, solve problems, all top things. And next slide, there really was not a lot of difference by subgroups here. And we didn't see a lot of difference depending upon whether you were a nurse or not, how many years of experience, whether you worked for an insurer, a large employer, or you're self-employed, whether you do more workers' comp or non-workers' comp, or what country you were in. A lot of consensus here. So for next slide, for some individual items, there were differences for a few individual items. So it was interesting. The nurses rated medical information, knowing medical information and analyzing medical problems, higher than non-nurses. And the vocational counselors, in contrast, rated job evaluation higher than the nurses. But when we talked to these people, they quickly said, that's only relative, and that only pertains to cases that are specifically referred to me for these skills. In the U.S., there was more focus on a quick response, policy development. In Canada, there was a little bit more emphasis on a client-centered approach. That's probably because of the organization of return-to-work coordination. And as you might expect in workers' compensation, because there's more conflict there, a little more emphasis on the importance of listening, recognizing the broad range of factors which could have a negative impact on disability, building relationships, and resolving conflicts. Again, not huge differences on the scale, but significant. Next slide. So to summarize these results, we saw a broad consensus across a range of different countries, different professions, different work settings, different emphasis, different types of cases that people got. A lot of consensus on what's most important here. And when we saw differences, it was easy to understand the meaning of these differences based on individual job differences. Next slide. So I think there are a couple implications here. One that has received a lot of attention in the U.S. is that sort of training and test taking is not delivering employers or insurers people who are necessarily going to have great results. And so when we think about training more and more, we're thinking mentorship, case studies, observation, and feedback. When selecting the right people for the job, it's more about personal attributes versus any sort of test results. And some of the informal feedback I've gotten since publishing these articles is that employers often feel they've been very successful hiring teachers, social workers, folks who've worked previously in a variety of human resource situations. It really draws into question, a lot of question, the value of current certification models in the U.S., Canada, and elsewhere. I think that there are still some gaps in this research. We've only heard from the so-called experts, and we do not know about the views of other stakeholders. We have some research that suggests that these identified issues are related to outcomes, but that has not been explored rigorously. And so in the next slide, I think the practical takeaway is that once you hire the right people, a lot of different people can develop the required skills as long as they've got good mentors. We also came across a lot of suggestion that organization, and this is not only the people employing the return to work coordinator, but also the organizations that they work for can either support or magnify or prevent good outcomes. And it has to do not only with policies and procedures, but is there early and positive contact? Are there accommodations? And do workers get a positive, we want you back message? We have a pretty good idea of what sort of skills are more related to results. So next slide, if you are interested in looking at the research results, we'd be happy to send you a copy of the articles. These are the 3 main citations, and the one that we published 5 years ago in the Journal of Occupational Rehabilitation in the spring of 2010, that's the main article that has the detailed results here. And I should say there's been a subsequent study published from Australia that kind of reinforces these results that had pretty similar findings that came out just a couple of years ago. So next slide. I want to thank you for your attention, and I'd be happy to take questions.
Okay, great. Thank you very much, Glenn. That was very good. I'm just going to give it a second to see if anybody types in some questions online. Do either of you here in the room have any questions? We're just waiting, see if anybody online has questions. I wasn't sure if you covered it, Glenn, but did you do just Canada and the United States in your research?
Canada, U.S., and Australia.
And Australia.
Both the focus group and the surveys included all 3 places.
Okay, wonderful. All right. There's one question. What approach to mentorship is deemed most successful?
Very good question. What I'm seeing is evolving a combination of case study, and then once people get a caseload, regular touching base with a mentor, perhaps even on a daily basis, and encouraging people to go to the mentor with questions.
All right. Any suggestions for how to become a good return to work specialist? So I guess key takeaways as to the best ways to do that.
I have trouble forgetting the sort of enthusiastic response that I got from someone in one of our focus groups when I asked that question. And she said to me, "This is the best job I've ever had, and the best way to get the right people is to find folks who are enthusiastic, who like a challenge, and just tell them to follow around the people who are tops in the field and learn from them."
So it really is.
Just make sure that that sort of challenges that you like doing.
Gotcha. So really the mentorship and kind of experiential learning that seems to be the best to find a good fit?
Yes, because it accomplishes several things. You learn the nuances of negotiation, what is and isn't possible. You get to figure out, is this really a job that you want to do? And your mentor gets a chance to see, is this going to be a match for your personality and your style? And can you modify it to really optimize your effectiveness?
All right. And then another one is, how could a return to work coordinator gather more information about the EE's occupation when ER cannot provide an official document detail?
It's that face-to-face contact with the employee that's most important.
All right. And to what extent were the return-to-work coordinators involved in your studies, quote-unquote, uncredentialed professionals?
I don't know, but I can tell you that in the U.S., very few people had any sort of return-to-work coordinator credentialing. I don't know about Canada. And in Australia, many people had completed very brief credentialing that is part of a federal system of return-to-work coordinator certification, but this is a sort of a brief training course that people complete there.
Okay. And then another question is kind of following that. What are the implications for certifications in return-to-work coordinators, which are designed to standardize the professional?
Well, it isn't clear to me that the current models of professional certification that we currently have in this area are leading to better outcomes. So sometimes I wonder whether this is a sort of putting the cart before the horse, because if you don't have good evidence that certification is improving an outcome, then it's not clear that it's necessary or valuable. What these experts are suggesting is that they want to select people and identify who's most appropriate for this role based on their observation of performance on the job. They're suggesting that that's most effective.
Gotcha. All right. And there's a question, where could people in Canada, since many of our attendees are in Canada, get this type of mentoring and training? What do you have any advice on how people can pursue finding a mentor or seeking that out?
This is a universal challenge. And I think in some ways the proliferation of certification programs is an attempt to try to address this void, because for a large insurer or a third-party administrator, they don't have much choice other than to hire people and hope that they will work out, to try to interview them and hope that their personalities and skills will be a match for what's required for the job.
All right. And then one attendee said that their organization requires return-to-work coordinators to be certified through certain disability management organizations, thinking that the stakeholder perception guides this. It would be interesting to see if continuing education requirements could have mentorship reporting in lieu of courses, was one person's thought.
I think that's a very good question. And I have to say that that sort of question prompted myself and my co-investigators to pursue this whole line of research, because we kept hearing from the top people in the field that these sort of formal certification processes didn't necessarily bring them people who were more effective.
Right. Okay. And there was a question, did any background, occupational therapy, nursing, whatever, out of all the ones you looked at, fare any better in becoming an effective return-to-work coordinator versus others?
No. some of the top nurses said that a specific medical background could be a liability, because if people get uncomfortable, sometimes they retreat to defining things in a medical context. And to be really effective, it's most important to keep the focus on return to work.
Gotcha. Okay, and then do you think that one person was asking that certifying bodies are the key to providing such a mentorship as a service, as part of, like, do you think that would be a good way for providing it?
It could be. My concern is that their business models are so tied up in formal courses that there's still sort of an inherent conflict there. It would be ideal if they could arrange for this sort of mentorship, but I think there's a conflict there that has to be resolved in some way, in that it's in their best interest to continue to have people taking courses and passing tests and getting certification in a more traditional way.
Gotcha. So that would be one of the things that your research is looking to kind of shift some of those mentalities over time?
Yes. Perhaps that could shift over time.
Yeah.
Or maybe some other organization who isn't currently in the certification business might take this up. So, for example, in the U.S., the American Association of Occupational Health Nurses has a lot of members who are involved in return-to-work coordination. And if one goes to the state or regional or the national meeting, you can meet folks who are highly experienced and well-known in the field, and it's not a formal arrangement, but maybe that's an opportunity to meet a potential mentor.
Right. So someone else had a question about what do you...
But it's a very good question. I have to say I don't have a good answer for how to solve that problem. It's a very good question.
Mm-hmm. Another question kind of similar is, what do you think about co-op training? Someone said they have students from rehabilitation post-secondary programs doing their co-ops so that people are able to mentor them and have found great results with that approach.
Interesting thing to think about. The only concern I have is that when you look at these key competencies, they require the ability to communicate with a lot of different people, to negotiate. It's hard to imagine a young student going into this field and being effective. I think this is an area where those who are most effective are people who've had a lot of experience dealing with folks in different situations. So this could be an area for some sort of reverse age selection.
Interesting.
Or older, more experienced employees are going to be most effective.
Right. Someone else said a recent presentation which they attended spoke to the research that showed that employees' return to work date was most influenced by their own perceived timescale as to when they would be ready to return. It was the EE's mindset that this was the most determining factor in successful outcome. So the question is, did your program look at the coordinator's coaching competencies and understanding of psychosocial influencers?
Those competencies were rated very highly. I think that's absolutely highly influential, or at least the predictive ability of their own expectations. But how to change that and how to influence that, that's an area where I think there are some very important opportunities. And these expert return to work coordinators recognize that that's a key skill set.
Gotcha. And then someone else was saying that what they have kind of taken away is that these competencies that you discussed, at the very least, are helpful for people who are looking to go into that as a career, to kind of say, oh, those are things that I'm strong in or that I'm interested in, or those aren't, and that could be helpful on that side.
Yes, I would agree. I think that's a very good point, that what this data does is also sort of characterize, this is where you've got to be strong, and these are, these are the sort of skills, knowledge, attributes you've got to have. And these are the areas or situations where your strengths can play out.
Right. Okay, it looks like our questions have kind of, oh, wait. Nope, I got one more. You seem to call for reflection activities to enhance competencies. Do you maybe have an example where an employer supported this approach, and was there evidence to suggest the improved outcomes?
I wonder if I'm not sure what you mean by reflection opportunities to improve competencies.
Okay, I'll give the question answer just a moment to see if they can clarify that. Attempt to see how work is going and on decision making.
So this sort of reflecting on what you're doing and looking for opportunities, this kind of self-improvement, this comes across in our interviews, but how this specifically is related to outcomes in an objective way, I don't have any more information than what's presented here, other than it's a consensus of a lot of people who are top in the field that this is key for them.
Okay, and someone else was saying that they think these competencies seem to be very similar to those in case management roles. Would you agree?
Yes, I would agree, but medical case management might be more straightforward or simpler because there aren't so many different people involved.
Gotcha. Okay. Well, I think that those are all of the questions.
I have two.
Oh, never mind. I'm sorry. We have some in-room questions. Yes?
Yeah. Will you hear?
Yeah, go ahead.
Yeah. I'm wondering about how to give feedback to organisations about the benefit of having good return-to-work coordination, and also information about what constitutes good return-to-work coordination.
So this is also a very interesting question. It's been tackled a little bit in Sweden, where people have tried to find ways of getting patients motivated and interested in working with someone in this role. There was actually a study published recently in Denmark of a multi-municipality trial of engaging people early on. And there have been several approaches to this. I think what they all have in common is tell people that if work's important to you, then you want to get someone who's a specialist in work, because the medical profession is good about treating medical things. But why you would want to work with a work specialist is that it's a separate issue. It's got its own, work disability has its own causes, its own treatment, its own perspectives.
And do you find that, are there any examples that you know of effective ways where people have gotten information like the competencies or this type of thing to employers? The actual dissemination activities?
Yes. So in these research results have been presented a few times at the annual Disability Management Employers Coalition meeting and have been featured in some DMEC publications in the U.S. So there are a number of large employers as an opportunity to improve or focus their own return to work coordination programs. So yes, the short answer is yes, it has been disseminated. I don't have any measures of how well or what the uptake's been or anything like that.
Right. Okay. And then we have one more question from here in the room.
When looking at the characteristics of return to work coordination, was a reasonable caseload identified? Because excessive workload interferes with the ability to provide face-to-face communication and support.
A very good point, and I wish we'd asked about that, but we didn't. Because, well, I can tell you that there's a few studies that have used return to work coordination, and those studies suggest that if you really want to be successful, you might need to reduce the caseload compared to what is typically seen in a fast-paced insurance environment. And there was a recent article published by Ian Cameron looking at essentially what's improved case coordination in auto accident cases in Australia. And one of the features of this was providing about 50% more contact time with case managers. And that's the only data I'm aware of that tries to sort of document the level of impact on caseload that's necessary to achieve desired results.
Thank you.
All right. Okay, I think that's all of our questions. Thank you very much for your time, Glenn, and for your patience with our little delay and with our technical issues. We're very glad to have you on with us today.
I'm so glad we were able to get it all worked out. No problem.
Me too.